Hello everyone, this is our fifth lecture. Today we will taking a history. How to take a full case history or a complete history. We have to cover the next aspects: personal details, presenting complaints, past medical history, which is abbreviated as PMH, drug history, family history, social and personal history, patient ideas, concerns, and expectations, and review of systems. The first aspect is the personal details. In the personal details section, we have to ask about the patient's address, date of birth, occupation, marital status, and this part is done by a nurse or the administrative staff in the hospital, for example. So, to find out this information, the patient is asked, do you work or what do you do for a living, in order to ask about the occupation. And they answer as unemployed, out of work, retired, a pensioner. What is the meaning of pensioner in Arabic? It's عن معيش. I work for a bank, I work in a factory. To find out or check a patient's marital status, we ask, do you have a partner? Or, for example, are you married? And the questions are no, I'm single, separated, divorced, yes, I'm married, all right? No, I'm a widow. Widow means a woman whose husband has died. Widower is a man whose wife has died. I'm a divorced. My spouse. What is the meaning of spouse? Spouse can refer to a husband or a wife. The word spouse refers to husband or wife. I live with my partner, spouse, husband, or wife, whatever. And of course, pass away means die. Talking about pain. In this part, we ask the patient about the symptoms that he suffers or she suffers from. Case notes are kept for each consultation. The piece of paper or the file that has the information and the symptoms that the patient suffered from is called case notes. We have, for example, this one. The patient suffers from right-sided temporal headache. What is the meaning of temporal? Temporal means temporary or happening for a short time. That is not a continuous headache. No, it comes and goes. Severe. Severe means strong. Throbbing. Throbbing means it has pulsing and beating sensation. Pulsing or beating sensation that happens over and over again. This is the meaning of throbbing, throbbing pain. So here we have a case note of a patient. We have the surname, the first name, the address, the date of birth, sex, marital status, occupation, and presenting complaint. In the presenting complaint, we have CO. CO is abbreviation of complain of. C/O means complain of or complains of. Severe headache, boring in nature. What is the meaning here of boring? Boring here is not the opposite of interesting. No. Boring pain is like a boring machine, comes from boring machine. The boring machine, as in the picture, is used in order to enlarge a hole that has been already drilled. All right? So the boring pain is like a drilling pain, all right, which is a strong pain. Um, Mainly in and around right eye, can radiate to forehead. We have taken before the radiation of pain, that it starts from one body part and moves to another body part. Comes on at any time and can vary in duration from 1 to 2 hours. No precipitating. What is the meaning of precipitating? It means that nothing bring it about or nothing cause this pain. That the patient did not observe anything that makes the headache start. All right? No precipitating or relieving factors. Has noticed halos. What is the meaning of halos? Halos means circles of light. Has noticed halos around lights with some blurry vision. Blurry means not obvious, or the word that we have taken before, opaque. Blurry vision in right eye and vomiting. So here, what are the questions that can be asked in order to have this information? We have, for example, do you have a partner? In order to ask about the marital status. We have, for example, what do you do for a living? In order to ask about the occupation. We have, can you describe the pain? In order to ask about the symptoms. We have, where does it hurt? Also the symptoms. Does it go anywhere else? We have here the radiation of pain. Where, when does it start? How long does it last? In order to ask about the duration. Does anything bring it on? Does anything make it better? Have you any other problem related to the pain? Let's move to this part. PMH, as we said, is abbreviation of past medical history. Past medical history, similar headaches, 10 years, coming every 3 months, often premenstrual, aggravated by eating chocolate, relieved by lying in dark room, can have visual aura, blurred vision, nausea, and vomiting. Let's see this conversation. Can you tell me what the problem is? I've got a terrible headache. Just here. So here the question will be, which part of your head is affected? Which part of your head is affected? Well, it's really bad and it throbs. Throbs, as we said, comes from throbbing, pulsing sensation. So the question here will be, can or could you describe the pain? Have you had anything like this before? Yes, about 3 months. I've had them for the last 10 years or so. Usually 1 or 2 days. This one started yesterday morning. So the question here will be, how long does it last? They usually start just before my period. Sometimes, if I eat chocolate, I'm not sure. So the question here will be, does anything bring it on? If I lie down in a dark room, it helps. Light makes them worse. So here, the doctor asks, does anything make it better? If I move my head, it gets more painful. So the question here is there anything else that affects it? Or does anything make it worse? Apart from the headache, blank, yes, my eyes feel strange. Sometimes I can't see clearly. Things get blurred. I feel sick and sometimes I am sick. So the question here is, have you any other problem related to the pain, or do you feel anything else wrong when it's there? All right, let's move to the next exercise. Gastric ulcers. Gastric here comes from gastro, which refers to the stomach. Gastric ulcers. We have peptic ulcers. They are, what is the meaning of peptic ulcers? They are open sores that develop on the inside lining of the stomach and the upper portion of the small intestines. The most common symptoms of peptic ulcers is stomach pain. Peptic ulcers include two types. The first type is gastric ulcers, which is in Arabic قرحة المعدة, that occur on the inside of the stomach. And the second type is duodenal ulcers that occur on the inside of the upper part of the small intestines. All right, the duodenum is the first part of the small intestine. So gastric ulcers are associated with, here in this part we will describe the pain. You can see in this table some of the words that describe pains. Like for example, we have aching or an ache, a general pain often in muscles and joints. Boring, as we said, like a drill, comes from the boring machine, the drilling machine. We have burning, burning that comes with heat. We have colicky. The word colic in Arabic means مغص. So colicky is an intermittent pain which varies in intensity, comes and goes in waves. We have crampy or cramp, an involuntary spasmodic muscle contraction. We have crushing, a feeling of pressure. We have dull, a background pain opposite of sharp. So we can have a boring pain that is like a drilling, a strong one, and we have dull pain that is like background pain, a mild pain. We have knowing, the G here is silent, knowing pain is like biting pain. Gripping, that has the feeling of tightness, grip. Scalding, that is like boiling water. Sharp, acute. We have stabbing pain, stabbing here like a knife. Stinging, that is sharp and burning, like the sting of an insect, like mosquitoes, for example. And we have throbbing, that is has a pulse sensation. All right. So let's use these adjectives in order to answer this part. Gastric ulcers are associated with, we can say, for example, with knowing and burning pain. Cystitis. What is the meaning of cystitis? Cystitis means inflammation of the bladder. Inflammation of the bladder. Cystitis causes what and what pain on passing urine. We can say here stinging, like the sting of an insect, and we can say scalding, that is like boiling water. Patient with a hepatic ulcer may say they have a what and what pain. We can say here sharp, and as we said in the gastric ulcers, burning pain. Recurrent abdominal pain may be described as, we can say here, as crampy, and also or colicky. Migraine is often described as a, we can say here, as throbbing pain, throbbing headache. People with osteoarthritis often complain of a deep ache centered in the joint. As we said before, arthritis is a general term that describes the inflammation of joints, because arthro means joint and itis means inflammation. So arthritis means inflammation of the joint. Osteoarthritis, also called degenerative joint disease, is most common type of arthritis. It happens when the cartilage in your joint break down, often in the hips, knees, or the spine. Kidney stone pain is sudden, severe, and sharp. Angina, what is the meaning of angina? Angina is chest pain. In Arabic, it means zabha. Chest pain or discomfort caused when the heart muscle doesn't get enough oxygen-rich blood. So angina is usually described as a crushing or heavy or gripping pain. Of course, in this exercise, there is no model answer, right? There is no one answer. You can answer as many answers as it goes, all right? Let's move to the next lesson, which is taking a history. As we can see here, we have taken the personal details, presenting complaints, past medical history. Now we will take drug history, family history, social and personal history. A drug history. It's essential to obtain full details of the drugs and medication taken by the patient. What is the difference between drugs and medication? The basic difference is that medicines are non-addicting, while drugs are addicting and would cause withdrawal effects. So medicines are non-addicting and drugs are addicting. Not infrequently, patients forget to mention or forget the name of drugs they take. Some may be over-the-counter remedies. What is the meaning of over-the-counter remedies, which is also known as OTC? It refers to medicine that can be bought without a prescription from the doctor. They are safe and effective when the patient follows the direction on the label. All right? So over-the-counter medicines, they are medicines that can be taken from the pharmacy without a prescription. Unknown to the general practitioner. The significance of others, such as herbal remedies or laxatives. What is the meaning of laxatives? They are substances that loosen stools and increase bowel movement. It's necessary to determine the precise identity of the drug. The dose. What is the meaning of dose? Dose means the quantity of medicine. Dose means the quantity of medicine. The frequency of administration, how many times, and the patient's compliance or lack of it. What is the meaning of compliance, the patient's compliance? It means adherence. Does the patient take medication on time or not? Does the patient take the medication on time or not? It's important to ask about known drug allergies or suspected drug reactions and to record the information on the front of the notes to be obvious to any doctor seeing the patient. Failure to ask questions or to record the answers probably may be lethal. What is the meaning of lethal? It means deadly. So the doctor has to ask the patient about everything, the allergies, the past medical history, and so on, in order not to prescribe a medication that may be deadly or lethal for the patient. All right, we have questions like the details of drugs and medication. The doctor asks questions like, are you taking any medication at the moment? Which tablet do you take? Do you use any over-the-counter remedies or herbal or homeopathic medicines? What is the meaning of homeopathy? Homeopathy is a system of medical practice that treats a disease, especially by the administrations of minute, very small doses of a remedy that would, in larger amount, produce in healthy persons symptoms similar to those of the disease. So, homeopathy depends on giving the patient small amount in order to be healed. If these amounts are large, the patient will have the symptoms that are similar to the disease. Frequency of administration, they ask about how many times a day. Compliance, do you always remember to take the medication? Side effects and allergies, like do you get any side effects? Or do you know if you are allergic to any drug? If the answer is yes, what symptoms do you get after taking it? The next part is about family history. To note the age, health, or cause of death of parent, siblings. What is the meaning of siblings? Siblings means the brothers and the sisters. The brothers and the sisters. Spouse, as we said, it means husband or wife and children. To find out about family history, doctors ask, do you have any brothers and sisters? Do you have any children? Are all your close relatives alive? Are your parents alive and well? And so on. So mainly it's about the asking about the health of the family in order to know if this family suffers from a persistent problem, all right, or allergy or anything like that. Social and personal history, record the relevant information about occupation, housing, and personal habits, including recreation. What is the meaning of recreation? Recreation means refreshment of strength and spirits after work. So, to ask about what this patient does for entertainment, any type of sports, anything like that. Typical questions in taking a social and personal history are like, for example, what kind of house do you live in? Do you live alone? Who shares your home with you? How old are your children? Are any of them at nursery or school? In order, for example, to know if they can have some of the common diseases in children. What's your occupation? Do you have any problem at work? Do you have any financial problems in order to know if this person suffers from any pressure? Do you have any hobbies or interests? What what about exercise? You can the doctor can ask about these information. Let's move to this exercise. Complete the sentences. Look at A, B, and C opposites to help you. Pharmacies sell a wide variety of, and we have dashes. So it's a wide variety of over the over-the-counter remedies, as well as dispensing prescriptions from physicians. Number two, the blank is the quantity of medication to be taken. So it's the dose. The dose is the quantity of medication. A drug, what is hypersensitivity to a particular drug? The answer here is allergy, a drug allergy. Number four, a what is a medication prepared from plants, especially traditional remedy. So here the answer will be a herbal remedy. Your brothers and your sisters are your siblings. Number six, blank is what you do for physical or mental stimulus outside work. So this is recreation. Number seven, what can take many forms? Apartment, single rooms, houses, hostels. The answer here is housing. Like here, occupation, housing, and personal habits. The patient's water to drug treatment, his willingness or ability to take the right dose at the right time and frequency is essential. So here, the patient compliance. Write doctor questions, look at B opposite to help you. We have here, my father died 20 years ago, but my mother is in good health still. She's 70 now. So the answer here will be, are your parents alive and well? So his father died, but his mother is still alive. I was still at school. He was 41. So this question will be, how old was your father when he died? He had a heart attack. So the question here will be, we are in number, yes, in number 3. Do you know the cause of death, or how did he die, or what is the cause of death? Number 4, I've got a sister of 45 and a brother who's 36. So the question will be, do you have any siblings? No, I had an elder brother, but he died in his 40s. He was 42. So the question is, are all your close relatives alive? So he has one of his brothers died. Like my father, a heart attack. So the question here will be about the reason of his death. What did he die of? What did he die of? Not that I know of. So this question will be about the family history. Do they have any problem, any illness that is persistent illness? Does anyone in your family have a serious illness? Apart from me, no. The question here can be, is anyone taking regular medication? Yes, a boy and a girl. He is 14 and she's 12. So the question here is, do you have any children? Do you have any children? Let's move to this exercise. Study the social history of Mr. Black. Write the questions the doctor asked to obtain the number of information. Whom lives in a detached house with a large garden? Family, 4 children, 2 girls, age 3, 4, 2 boys, age 6 and 8. Occupation, manager of DIY warehouse, stressful job, large mortgage. Mortgage means rent, that the payment, the installment that he has to pay in order to have the house. Personal interest, has little time for exercise habits, personally smoking 20 per day. So we have here the from the information that the doctor got, he can detect that this person suffers from a stressful life and he is a smoker. All right. So what are the questions that can be asked in order to have these answers? We have, for example, what kind of house do you live in? Are any of them at nursery or school? About his children? Do you have any financial problems? Do you have any hobbies or interests? Do you smoke? How many a day? Have you tried giving up? How much do you think in a week? Do you drink in a week? Can you give up alcohol when you want? So all of these are questions in order to know the information about the uh, patient in order to prescribe the right medication. So let's move now to taking history 3. Reviewing the systems, like for example, the central nervous system. Reviewing the systems. Once you know the main reason why the patient wants medical attention, it's sensible to ask about the systems to determine the patient's general state of health and to check for any additional problems. The patient should be encouraged to describe symptoms spontaneously. Initial questions should be open-ended. What is the meaning of open-ended questions? Like, for example, to say, what's your appetite like? The doctor should not say, for example, have you eaten today? Because this question is, the answer for this question is yes or no. So, in order to get all the information needed, the doctor should ask open ended questions like, what's your appetite like? How is your vision? Instead of saying, is your vision ever blurry, for example. So these are called open-ended questions and these are called closed questions. Follow up with more specific questions if needed, but avoid putting words in the patient's mouth in order to give the patient the chance to describe everything and to give vent to everything he or she feels. Asking about the central nervous system. The central nervous system consists of the brain and the spinal cord. It consists of the brain and the spinal cord. Asking questions like, do you suffer from headaches? Have you ever had a blockout? Blockout means loss of consciousness or vision. What about fits? Fits means a seizure or convulsion, تشنجات, especially one caused by epilepsy that we have taken before, الصرع. Alright? Have you had any dizziness? Do you get ringing in the ears? Have you ever experienced any numbness? Numbness that you don't feel any sensation in a specific part for a temporary time. This is called in Arabic التنميل, or tingling in your hands or feet. Do you have any problems sleeping? The next part is patients, ideas, concerns, and expectations, which is abbreviated as ICE. All right? Ideas, concerns, or expectations. In order to make the patient feel that all his expectations and are met and that he is satisfied, the doctor should ask about the doctor, the ideas, the concerns, and the expectations. Of course, this is in the perfect way of examining. What do you know about this problem, condition, illness? Do you have any ideas about this? Do you think you got, how do you think you got this problem? What do you mean by concerns? Like, what are your worries about this? Do you have any concerns? How might this affect the rest of your family? Expectations, like, what do you think will happen? What do you expect from me? What were you hoping we could do for you? All right? Phrasal verbs in history taking. This phrasal verb, it means a verb and a preposition. This is used in spoken English, in informal English a lot. Like, for example, bring on. Bring on means cause or induce. So you say, for example, is there anything special that brings on the pain? Bring up means expectorate or vomit. Expectorate means spit. Like, for example, when you cough, do you bring up any phlegm? G here is silent. Carry on means continue. Like, carry on taking the painkillers for another week. Come on means commence or start. Like, when does the pain come on? Give up means stop. Like, my advice is to give up smoking. Put on means gain weight. Like, for example, I have put on a lot of weight in the last month or so. Turn out happened in the end. Like, she had all tests and it turned out to be cancer. Turn up means appear unexpectedly. Like, the rash just turned up out of nowhere. So let's have the exercise for this part. Match the numbered questions from 1 to 7 in B opposite in this part. To the symptoms for central nervous system from A to F. There are 2 questions for one of the symptoms. For example, for headache, do you suffer from headaches? faints, that he lose consciousness, يغمى عليه. Like for example, have you ever had a blackout? Fits, like what about fits? Faints, like have you had any dizziness? Hearing symptoms like do you get ringing in the ears? Tingling, like have you ever experienced any numbness or tingling in your hands or feet? Sleep pattern, like do you have any problems sleeping? Here we will read this conversation and we will say this talks about the patient's ideas, concerns, or expectations. I'm a bit concerned about my colleague. I had a friend with something similar and it turned out to be more serious. It's got me worried. What do you mean by colic? So, this here, the doctor asks about her ideas. A pain in the stomach. What do you think might have brought this on? This is also asking about her ideas. It just seemed to come on. I don't know what it is. You said you were a bit worried because your friend had a similar problem. What are your worries about this? So here he asks about her concerns. Yes, I had a friend. She turned out to have stomach cancer. She actually died in the end. What were you hoping I could do for you today? This is expectations. I just want to know that I don't have anything too serious, right? So here the last question he asks about her expectation. Let's move to the next question. The headache blank in the morning. So here we will answer from the phrasal verbs here. Bring on, bring up, carry on, come on, give up, put on, turn out, turn up. The headaches in the morning. So the headaches come on in the morning. How much I eat? I don't seem to put on put on any weight. I've tried to smoking several times, so I try to give up. I'm so depressed, I don't feel I can carry on, continue. When I cough, I blank phlegm, I bring up. He thought he had stomachache, but it was to be cancer. It turned out to be cancer. So this is for our lecture today. Goodbye.